Okay, maybe your student, nurse, practitioner, student today. We're gonna start off with examining your TMJ joint. Go ahead and just relax. I'm gonna palpate the joint. Go ahead and open and close. It's equal, it's smooth, there's no crepitus. We have the condyle of the jaw, mandible, temporal joint, and the zygomatic process. I'm gonna move on to your neck. We're gonna inspect for equalness, symmetry, size, no lumps. I'm just gonna palpate around. We have the sternomastoid muscles, we have the traps, we have the rhomboids, and we have the cervical spine. It's gonna start with C1, palpating down to C7. Any pain?
No.
Go ahead and flex your neck, chin to chest. There's C7. Alright, go ahead and extend. Rotate right and left. And then a lateral, ear to shoulder, other side. You have smooth movement, it's equal, it's symmetrical. We're next gonna move into the shoulders. We're just gonna examine posture, the girdles of the shoulder, if they're anterior, posterior. We have the scapula in back and the clavicle in front. We can follow those up to the acromion process and then palpate down through the shoulder. And then we have the caracoid process in there. I'm just gonna move your arm back just a little bit, just to help. Perfect. And then we're gonna do some range of motion. Go ahead and do a flexion all the way up. We're gonna do extension. Perfect. Abduction and adduction. Perfect. I'm just gonna have you hold your arm out to the side. We're gonna do a drop arm test. Go ahead and just controlled let down. That examines for rotator cuff tear. And then we're going to do a Hawkins test. I'm just gonna hold your arm at 90 degrees. I'm gonna go ahead and internally rotate. Tell me if there's any pain. No sound of crepitus, smooth movement, no pain. Go ahead and relax and let down. I'm gonna have you turn your thumb down. I'm gonna have you flex all the way up. Perfect, that's a Mears test. Examining again for supraspinatus tear injury. And I'm gonna have you have both arms out, rotate thumbs down, and press against me. Perfect, again, testing for rotator supraspinatus injury or tear. And that is the empty can test. Next we'll move on to elbows. Go ahead and just relax at 90 degrees. On the inside we have medial condyle and a lateral on the outside, the cranium process. In there we have an ulnar nerve in between the medial. Then we inspect, no noticing of any bumps. They're equal, no signs of atrophy. Alright, go ahead and flex elbows up, extend out. Relax at 90. Your forearms, I'm going to have you turn upward, turn down. So we're supinating and pronating, testing the forearm. We're going to move into the wrist. Go ahead and relax. We have radial condyle, ulnar condyle, metacarpals. Moving more so into carpals, we've got the MIP, the PIP, and the distal or PIP. I'm just going to inspect outside for any differences. They're symmetrical, no bony prominences, no nodules on PIP or DIP. Just going to inspect the thumb. We have the snuff box or the scaphoid area. I'm going to squeeze each arm. I'm going to test each finger. Everything is smooth, symmetrical, equal. Assess for pain. Give me 1 squeeze. Good, +5 strength. I'm going to have you relax your arms out. I'm going to tap the Tinel's test. Let me know if you have any numbness or tingling in the 2nd to the 4th fingers. Go ahead and bring your hands up for Tinel's test. Any numbness or tingling?
No.
3 to 4, perfect. Go ahead and relax your arms. We're going to move into the hips. I'm going to have you stand up, please. We're just going to evaluate for balance. You and locate the iliac crest, anterior, superior iliac crest, and then come into here. We have the trochanters and the ischial tuberosity right below. Any pain?
Nope.
Inspection, they're equal, they're level, there's no tilting. I'm gonna have you bend forward and touch your toes. We're gonna do some flexion, so go ahead and stand up, go back, we're gonna extend. I'm gonna have you come forward, we're gonna go ahead and reach your right leg to your right foot. Lateral bending, other side. Smooth movement and symmetrical. I'm gonna have you rotate side to side, testing hips and thoracic. Smooth movement equals strength. Go ahead and have a seat and lie down. I'm gonna go move onward to the knees. Go ahead and relax up at a 90-degree. Sorry. Oxymoron. Go ahead and just inspect the knees. Just touching, feeling for pain, looking for any bumps, bruising, atrophy. We have the femoral and the femoral head. We'll have the tibial or the tuberosity, lateral condyle on the outside. Right in here between under the patella, we have the anterior joint line, inspecting for pain and checking meniscal area. Perfect. I'm gonna have you kick your leg up. Good. And down. Bring up towards you. We did flexion and extension. Perfect. I'm going to have you can relax that leg down. Do hips. Go ahead and relax this leg. And I'm gonna do all the movement. I'm just gonna grab this leg and I'm just gonna pull it to your right. Any pain with that?
No.
Checking the LCL, lateral. I'm gonna do the same, but with the other side. And that's checking the MCL. Any discomfort, pain, crepitus. I would compare one side to the other side. Usually if there's pain or weakness or too loose of activity would be signs of abnormal. Next we're gonna do the McMurrays. I'm gonna go ahead and hold your leg and relax it. We're going to flex upward. And we're going to invert the foot and slowly extend back out. We'll flex back up, invert the foot, or valgus, and then we're going to extend back out. Checking for pain, tenderness. Go ahead and relax. I'm going to bend this leg up, and I'm going to stabilize this foot, and I'm going to do an anterior drawer. Just pressing down, checking for the ACL, and a posterior, just checking for the PCL, checking for pain, clunking, and any sort of difference from one side to the other side. Go ahead and relax. I'm going to go ahead and check pelvis range of motion. Once I can do that, I'm going to go up, relax. I'm going to flex upward. All right, I'm going to come out and do internal rotation and go up, and I'm going to do external rotation of the hip. Smooth, no crepitus. Go ahead and relax. I'm going to have you just turn on your stomach. We'll check external rotation. Go ahead and relax that leg on that shoulder. I'm going to stabilize and bring that one up. Okay, that's extension. Go ahead and flip back over. I'm going to bring your leg out towards me for abduction of the hip. And you can always stabilize the other hip if need be, checking for any pain, lack of range of motion, or lifting of the other leg. I'm going to have you bend this knee up and put it over that leg. I'm gonna grab this leg and pull it towards me for adduction. Any pain or
No.
decreased range of motion? Alright, go ahead and relax. Then we're going to come down to the ankles. We have medial and lateral condyles palpating around the ankles. Just gonna move your socks if you don't mind.
Sure.
We're going to inspect the skin, looking for any abnormalities. Everything's symmetrical. We have the navicular area on each side. We have the Achilles and posterior heel, checking for spurs, plantar fasciitis, metacarpals, squeezing the metatarsals, checking each one for any pain, nodules. I'm going to have you flex down, point your toes down for plantar flexion, toes towards you for dorsiflexion. I'm going to have you point your toes towards each other, eversion, point opposite out for inversion was towards each other. You can relax. Next we will come around and I will have you stand up. And you can face that way. I'm just gonna lift your shirt if you're okay with it.
Yep.
Relax arms down. I'm gonna start with palpating the spine. We inspect it first. Inspect for any lordosis, kyphosis of the upper back, normal curvature of the lumbar. And I'm just gonna start up C1. And there's about C7 right when they flex, starting into T, going down the spinous process, knowing that T7 is right around the shoulder end of the shoulder blade. We'll get into T12 and then we'll cross over into lumbar. We have L1, 2, 3, 4 being right at the side of the iliac crest. And then we'll reach into sacrum, S1 and S2. Here we can find the crest. We can find the SI joint and the superior spine right in there. Again, ischial tuberosities. I'm going to have you go ahead and flex and reach your toes, noting normal curvature of the spine. And we can palpate muscles, the paraspinous muscles, supporting, checking for symmetry, atrophy, any spasming, checking the rhomboids between shoulder blades, the traps. Go ahead and relax. We've already done rotational, which checks thoracic. And I'm going to have you just walk, you can picture it down. I'm going to have you walk to the end and back, just establishing a normal walk, a swing of the arms, any pain when we bear weight and lift, which is usually in the pelvis. And you can go ahead and sit for a sec. And I'm just going to check real quick if we hit everything. Oh, one more. If you can lay back, I'm going to do the straight leg raise. I missed this one earlier. You can go ahead and just relax. I'm just going to lift a leg up.
Mm-hmm.
This is testing for the lumbar radiculopathy or disc herniation. Probably about 35 to 70 would be more disc. Above 70 is going to be more the SI joint. I'm just helping keeping the leg straight. Go ahead and relax. And great, we would normally compare one side to the other side, make sure there's no atrophy, make sure they're same size, make sure there's no nodules, bumps, or edema or redness. And I think that's about it.